Now, that black discoloration you're seeing on your scalp after you just had your hair transplant might be the warning sign that you need to know that that is an emergency. What I need you to do is to call your hair transplant surgeon or call the clinic and let them know you are seeing a black spot on your scalp. If you're coming across this video about to go for a hair transplant or you're dealing with hair loss, I need you to sit right here and watch this video to the end, because what I'm about to tell you is a top secret that no other hair transplant surgeon will let you know until it happens to you. And if you're coming across this video for the first time, you're seeing me for the first time, my name is Dr. Chefu. I'm a hair transplant surgeon, a hair loss coach. I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. I'm going to be telling you what that black spot on your scalp. And you're wondering, what is this? How can this be prevented? Now, you see this picture right here? This picture did not just come up all of a sudden. No, it started from a small dot and the person ignored it and it became this way. What might have caused this and how to prevent it? And I'm going to give you all these 3 things for free. Now, what this picture is showing us is not your regular hair transplant procedure. This is a complication from hair transplant. Most people might think, oh, it might just be part of your hair transplant. Ignore it. Please do not ignore it if this is you. You need to actually take pictures of the area and send it to the hair transplant clinic so that somebody can take a look at it. This is actually what is called scalp necrosis, area of decreased blood supply. There was actually no blood supply after the hair transplant. And it can even start as early as that, immediately after the hair transplant. And that's why after the hair transplant, we take pictures after the hair transplant. We'll keep watching and making sure that the area is everywhere looks good for a couple of days. You see, so if this is you, I need you to take a note. I'm going to be telling you a couple of things that might lead to this. So number one reason that I tend to see that causes this scalp necrosis is mega sessions. What are mega sessions? Anytime you are promised more than 3,000 hair grafts in a day, that's a mega session, okay? And you run into the problem of high density packing, especially if the hair transplant surgeon has poor surgical skill and planning. So I want you to understand that, because there's low density and there's high density hair transplant procedures. Low density means minimal amount of hair grafts in a given area. And number 2 is high density packing, the maximum amount of hair grafts you can use in a given area of the scalp. Once you're promised the 3,000, 4,000, 5,000 grafts, your next question to the hair transplant surgeon will be, are we going to do it in one day? Or it's going to be 2 days? We do the hair transplant today, do another hair transplant after 9 months. So that's the question you need to ask. People tend to run into these problems with these promises. Sometimes you just have to inconvenience yourself if it's going to be a 2-day procedure. I prefer you have a 2-day procedure than having 1-day procedure of 5,000 grafts, and you might run into this problem, this scalp necrosis. Now, number 3, your medical history is very important. Medical illnesses, especially if it's not under control. Do you have a history of diabetes? Have you had a heart attack in the past? Have you had a stroke in the past? Do you have any issues with your blood vessels? These tend to be the issues you can run into. If you have all these medical issues in the past and you're planning for a hair transplant, and now if they're also planning to do a mega session on you in a day, or my recommendation is avoid mega sessions. Ask for a 2-day procedure, or you decide to do a lower density hair transplant. So you have to understand that your medical history is very important, and also smoking, because what? It's part of your medical history. So you need to let your hair transplant surgeon know. Now, number 4, if you have a history of scarring alopecia, and that is why I always recommend a proper scalp and hair evaluation. It's not just enough just having a virtual consultation with someone and now they say, yes, you're qualified to get a hair transplant. I want you to understand that. If you run into that issue and they promise you, hey, come on in, you are good, come on in for the procedure, and when you get over there and nobody takes a look at your scalp or properly examines your scalp and your hair, that's a problem. Because you might have scarring alopecia, there might be an inflammation. And guess what? You have an inflammation, you do a hair transplant, you do a mega session, They do high density packing. That's the problem. You can run into the problem of decreased blood flow around the area of transplanted area. You can have scalp necrosis. So proper scalp and hair evaluation is not optional, it's a must. And now the final one is all about the medication that was used during hair transplant procedure. Now we use epinephrine, which is a medication that helps in vasoconstriction. That means what? Constricts your blood vessels so that it will reduce bleeding so that we can properly do a hair transplant. Now, if they use too much of it or too concentrated form of epinephrine, without adequate monitoring, guess what? That can definitely cause decreased blood supply to the area and give you scalp necrosis. So that's why it's very important you do your own part and also do your part on doing your research to know who is doing your hair transplant procedure. And medical history is also very important. So in summary of what I've said, what we're looking at here is a case of scalp necrosis. And typically it can start as early as immediately after your hair transplant. After 5 days or 6 days or a week, and you don't see that, unlikely you will have scalp necrosis because you tend to see it early on. And what do I recommend? You reach out to the hair transplant surgeon that performed your procedure, or you make an appointment with us and somebody from my team will help take a look at it and talk to you and guide you to the next step. And the reasons why scalp necrosis occur is basically one, if you're promised a mega session, which is anything above 3,000 grafts in a day. Number two, your medical history include diabetes, history of smoke, heart issues, and all that. You are basically under the high risk people that can definitely get scalp necrosis, especially if your medical issues are not under control. Then number three is high density packing, especially if it's in the mid scalp area right here. Number four, if you have scarring alopecia, especially most people don't know they have scarring alopecia. They just go for the hair transplant without doing a proper scalp and hair evaluation. So I always recommend a proper scalp evaluation before a hair transplant. Then finally, excessive epinephrine use, especially during hair transplant procedure. So it's very important, to discuss all this with your hair transplant surgeon. So what do I recommend? Really take a picture, send it to the hair transplant clinic or go to ISHRS and look for a hair transplant surgeon closest to you that can help you deal with the situation. Or one simple solution is just to make an appointment with us. Yes, that somebody from my team will get in touch with you, talk to you, and know what you're dealing with, so we know how we best to help you. Now, if you've loved this video and you've watched this video to the end, I promise you will love every of my video on YouTube. Go to YouTube. YouTube name is Dr. Echefu. I teach you simple tricks and tips on how to make the right decision when it comes to hair transplant. I know you won't find this any other place. All I wanted to say is thank you in the comment section and ask me any questions and I'll do my best to answer all your questions. Until next time, stay safe. Bye-bye.